Good evening, everybody. This is Khalfan Almazroi, clinical pharmacist at Khola Hospital. Thanks for attending this evening with us, and I would like to express my special thanks to Oman Pharmaceutical Society for its continuous update and webinars on COVID-19. May Allah keep us all safe. Today, Pharmaceutical Society has invited pharmacist Isra Allawati from Almazroi Hospital to update us about COVID-19 and mental health. Pharmacist Isra is a pioneer psychiatric pharmacist in Oman. She has completed her BSc degree of pharmacy in 2011 in Oman and started her pharmacy journey at Almazroi Hospital, where she was in charge of inpatient pharmacy. In 2017, she had her MSc Clinical Pharmacist Development at Robert Gordon University in Scotland. She has a massive role in the development of pharmaceutical care at Almazroi Hospital. Dear all, let us start our evening. Please feel free to note down your questions at the screen down there in Q&A icon. Now, make sure your microphone is muted, please, while the presentation is going on. And welcome with me, Pharmacist Isra. Pharmacist Isra, welcome.
Hello, good evening all, and welcome to the third webinar of the Oman Pharmaceutical Society. Thank you, Pharmacist Khalfan, for this beautiful introduction. And before I'm starting my session, I would like to take this opportunity to thank my colleagues in the Oman Pharmaceutical Society for their really hard working behind the scene to make this session successful. And at the end, I hope that most of the people, healthcare providers or the other population, to be more relaxed and flexible while dealing with the COVID-19 situation. Right. So as Pharmacist Khalfan mentioned that today I will talk about the COVID-19 situation and mental health. I'm Isra Allawati, clinical pharmacist in Almazroi Hospital. So let's start. Today we will talk about, I will not go in details about what is coronavirus, how it started, how it will be spreading, what is the treatment guideline, as my colleagues previously in the previous webinar, Pharmacist Ahmed and Pharmacist Zahra already mentioned about them. So we'll be focusing more on the mental health setting. The use of antipsychotics during COVID-19, key messages for all, managing the anxiety of COVID-19 and healthcare workers, and how to get rid of these negative thoughts during this situation, and then the conclusion. So in the beginning, let's talk about COVID-19 in general. So in January 2020, the World Health Organization, WHO, declared the outbreak of a new coronavirus, COVID-19, to be a public health emergency of an international concern. WHO stated that there is a high risk of COVID-19 spreading to other countries around the world. In March 2020, WHO made an assessment that COVID-19 can be characterized as a pandemic. WHO and other authorities around the world are acting to contain the COVID-19 outbreak. However, this time of crisis is generating stress throughout the population. So many of the organizations, including WHO, developed a series of messages that can be used in communication to support mental and psychosocial health in different target groups during the outbreak, which I will be talking about it today. So let's go to the use of antipsychotics during the COVID-19. As we all know that COVID-19 is a new disease and it happened in a very short period of time. So there is no approved protocol or policy for using the antipsychotics during COVID-19 or during patients having COVID-19. However, the Royal College of Psychiatrists have developed a policy or a protocol that have some messages regarding some specific antipsychotics. First, it is about continuing treatment with commonly prescribed psychotropic drugs. So careful consideration should be given to whether now is the best time to withdraw or change patients from antidepressant, anxiolytic, or antipsychotic medications. Then for many patients, it's likely that advice will be given to continue on regular medication without changing until this can be reviewed in face-to-face setting with their usual doctor or healthcare provider. As we all know, or most of our colleagues in the other hospital or primary care units, that the general appointment have been postponed this period to prevent the spreading of the virus for the patient safety and the staff safety. So it's not advisable to change in the patient medication in this period of time. So this should take account of the fact, the problem that anxiety and depressive psychotic symptoms are likely to worsen during extreme stress and social disruption, which lead to increased risk of relapse or recurrence of affective and psychotic illness, unfortunately. We need to advise our patients to continue their current dosage until the changes in the healthcare provision necessarily during the COVID-19 outbreak have been reversed, and only then consider whether dosage reductions or withdrawal might be appropriate in discussion with their usual doctors. Then we will talk about the treatment with lithium in febrile patients. As we all know or might not know, that lithium is the medication used for a psychiatric illness called bipolar disorder. So lithium is a medication with narrow therapeutic index, which have a risk of toxicity. This risk of toxicity is increasing with dehydration. Unfortunately, febrile patient may become dehydrated easily, and lithium level may rise. So this put the patient at greater risk of toxicity. So we need to look for signs of potential toxicity, such as coarse tremor. If these are present in our patients, we should obtain an urgent lithium level, even if it's not the proper time, even if it's not the due time of the level. Then if there is any delay in obtaining a lithium level because of the situation, for example, the road is closed, the doctor is not on duty, or any extra things, so the specialist should pause the treatment and obtain a lithium level as soon as possible. So ongoing treatment and the dose used should be governed by blood levels, and to be aware that sudden discontinuation lithium can be associated with a rapid relapse of symptoms, particularly mania. Mania is when the patient of bipolar disorder feel hyperactive, mix of thoughts, insomnia, which is inability to sleep. So then caution should be exercised until the patient has regained physical health, with increased frequency of monitoring of lithium level and renal function, which is the most parameter that affected by lithium therapy. Depot injection. So if we will talk about depot injection, which is the long-acting injection, and if the patient describes COVID-19 symptoms and is due to have their long-acting administered, consult the prescriber, the patient prescriber, or their deputy, and consider as an alternative short-term treatment plan, such as deferring treatment for 2 weeks, okay, but to be sure that the patient is psychologically well and risk of rapid relapse is considered low. Otherwise, we cannot change any of the medication because we are dealing with a very challengeable criteria of patients. Or we can switch to oral formulation, but in any other way, we need to refer to guidance about dosage equivalence or to the treating doctor. So if the decision is made to defer the depot or long-acting injection, ensure a planned risk assessment is agreed and documented with a follow-up with continued monitoring of mental and physical health, with the agreed date of when to review and next administer depot injection. We have a lot of long-acting injection and under the Ministry of Health. Then if the patient describes COVID-19 symptoms, but it's essential to administer depot long-acting, so in any way we need to wear the PPE or the staff nurse to wear the full PPE, the personal protective equipment, and follow infection protection and control procedures. In all the circumstances, we should ensure a clear plan which is agreed and documented with patient relatives, care coordinator, and the consultant responsible for the patient care or the deputy regarding follow-up after depot administration. And monitoring of physical and mental health symptoms is very necessary. We should also ensure that our colleagues, pharmacists or the doctors or all healthcare providers and other primary care are made aware of any changes to pharmacological treatment. So that was regarding Royal College of Psychiatry. There is another guideline or policy that was developed by the National Association of Psychiatric Intensive Care and Low Secure Unit, which was about managing acute disturbance in the context of COVID-19. I included the part of the medication that is used in acute disturbance during COVID-19 situation. So if we will go to this protocol, they included if a patient with suspected or diagnosed COVID-19 is acutely disturbed and there are no signs of respiratory, which is cough or shortness of breath or others, then medication can be used with caution as the full effect of COVID-19 are still unknown. Consider always short-acting medication as a patient's physical health condition may rapidly deteriorate. Where possible, oral medication is preferred and should be offered as the first choice. Parenteral or injection is also more likely to cause dose-related side effects, and the problem is with the long-acting injection, it needs more time to be reversed, especially if there is a very serious side effect. But after all, it's not like an approved policy or guideline. It's just a tips to help us to deal with this situation. And it's all depend on patient situation and condition. Then as COVID-19 is known to affect respiratory function, patients, psychotropic medication, especially benzodiazepine, which is a group of medication that help to sleep and reduce agitation of psychiatric patients, can cause respiratory depression as a very common side effect. So benzodiazepine, including diazepam, lorazepam, clonazepam, should not be used when a patient is having acute pulmonary insufficiency. Then if there is any evidence of cardiovascular disease, including prolonged QTC interval or no recent ECG, avoid intramuscular haloperidol combined with intramuscular promethazine injection or any medication that directly affect the QTC. All antipsychotics can cause neuroleptic malignant syndrome, which is a very rare side effects that happen from all antipsychotics. It's a very serious side effects which may cause fever and stiffness, very like hard stiffness. So in case of NMS occurs, immediately discontinue antipsychotics and other drugs that may contribute to the underlying disorders, monitor and treat symptoms, and treat any concomitant serious medical problems. Physical health monitoring, especially respiratory rate and level of consciousness, should be carried out when either oral or parenteral rapid tranquilization is used. So these two protocols or policy were the only policy that I have been checked recently during COVID-19 situation. Now we will go to the part which is I really feel that it's a very important part for all the population, either the general population, healthcare providers, elderly people, or children, which is a very simple messages for all of us just to deal with the COVID-19 situation as a normal situation as we can. So first we'll talk about messages for healthcare workers that are working in the hospitals or in the primary care units. So feeling under pressure is a likely experience for you, okay, and your colleagues, and many of your colleagues also, yes, as I mentioned. It's quite normal to be feeling this way in this current situation. As we all know, it's a very new situation. Some of us might never had like previously with these situations, like a very to be in under pressure, under stress, like a long duty hours or shortage of stuff. So it's okay. All of us are in the same boat. So we need to be more relaxed about this issue. Then we need to take care of ourselves, use helpful coping strategies such as ensuring sufficient rest, eat healthy food, engage in physical activity, whatever activity, not necessarily like a very hard workout, maybe walking, jogging, dancing, or even yoga or meditation. And always stay in contact with family and friends, which is a very important part. You may also unfortunately experience avoidance by family or community owing to stigma or fear, which is happening to most of us who are working in the hospitals. We feel afraid to go to our family, to our friends. So that's fine. It's a very, for a short period of time, it will go. So if possible, just stay connected with them through digital methods, video call, phone call, or whatever. So how we can manage this anxiety during COVID-19? We need, as I mentioned, to take care of ourselves, eat healthy meals, drink plenty of water, and sleep well. We are not alone. Talk to your colleagues, specialists, or someone that you trust for support. Take regular breaks during your shift to reduce stress. Ensure having accurate and update news on COVID-19 situation, and ensure always to reinforce safety precautions at all times. That was regarding the healthcare providers. If we go to the messages for the general population, so always and forever do not attach this disease to any particular ethnicity or nationality. Be empathetic to all those who are affected. So people who are affected by COVID-19, they didn't do anything wrong. They need our support, our love, and kindness. Then do not refer to people with the disease as COVID-19 cases, victims, COVID-19 families, or the disease. They are people who have COVID-19, people who are being treated for COVID-19, or people who are recovering from COVID-19. So in any way, these people will be recovered and they will return to their normal life, to their workplaces, to their family and friends, and they need to be dealt as normal. And the most important thing, we need to minimize watching or reading news about COVID-19 that causes us to feel anxious or distressed. Seek information only from trusted sources and mainly so that you can take practical steps to protect yourself and loved one. One of the trusted sources can be the Oman Pharmaceutical Society account in the Instagram or Twitter or the Facebook, a Ministry of Health account or the WHO website. So these are all trusted places to be taken. Find opportunities to amplify positive and hopeful stories and positive images of local people who have experienced COVID-19 and recovered. Honor carers and healthcare workers supporting people affected with COVID-19 in your community. Acknowledge the role they play in saving lives and keeping your loved ones safe. People working directly with COVID-19 patients with people with COVID-19, they are dealing every day with they are keeping their life under risk every day. They are away from their families, their friends. So just give them little bits an honor and support to make it for them easier. So now we'll go to the part messages for older patients or older adults, people with underlying health condition and their carers. These are a very special criteria of people. We need to know how to deal with them. Recently, a lot of us here COVID-19 only affects elderly, so that's fine. No, these people also need to deal with them in a very special ways, so we will not affect their health or mental health, not only the physical. The mental health is very important for these criteria of people. So older adults, especially in isolation, and those with cognitive decline like dementia, may become more anxious, angry, stressed, agitated, and withdrawn during the outbreak or while in quarantine. So practical and emotional support through informal network, families, and health professionals must be provided for them. Simple facts about what is going on must be shared with clear information about how to reduce risk of infection in words that they can understand, like in a very simple word. Repeat the information whenever necessary. It's not necessary to repeat the information every hours or every hour or every minute or every day. Maybe when they need to know something new or something like um, announced from the Ministry of Health or the trusted sources, we need to tell them. Be prepared and know in advance where and how to get practical help if needed. They should know how to react if there is any something urgent happen, like call a taxi or someone from the family, having food delivered, and requesting medical care. Make sure you have all your regular medication that they may require. So make sure that your family, your parents, your people who you are caring of, they have all all the medication they needed during this period of time. They need to learn simple daily physical exercise to perform at home in quarantine. Even if a 10 minutes, 20 minutes walk, it's even enough for them just to to make their body a little bit active. They need to keep regular routines and schedules as much as possible or help create new ones like cooking, like baking, like sketching, like watching funny videos or something related unrelated to COVID-19. This one, now we reach to the last part of the messages is for people in isolation. People in isolation, they need a lot of our support, a lot of our love, because they are in a critical situation in this 2 weeks or 3 weeks of time. So we need to stay connected and maintain people in the isolation must stay connected and maintain their social networks. They can stay connected via telephone, email, social media, or video conferences. During times of stress, all people in isolation, they reach to a level of stress in some way. They need to pay attention to their own needs and feelings, engage in healthy activities, as I mentioned before and many times. They need to eat healthy. They need to enjoy and find relaxing and something they like to do. Exercise regularly and keep regular sleep routines. So seek information, updates, and practical guidance at specific times during the day, not the whole time of the day, okay, from health professionals and WHO website, and avoid listening to or following rumors that make you feel uncomfortable, because nothing will be changed. This is the situation, it's for all, nothing will be changed for anybody, or it will, or yeah, it will just affect your mental health and your a lot of people cannot even sleep at night because they are just keep thinking about what will happen if something like this. But you should just hear the messages from a specific time at the day and just keep the things going on from the trusted and sources, and inshallah everything will be fine. So for all people, how can I get rid of my negative thoughts during this situation? So be conscious of your thoughts and replace negative thoughts as you can with positive one. Keep yourself busy with an activity that you like. A lot of people now start baking, cooking, drawing, sketching, watching a series or something that they like. Avoid triggers that cause negative thoughts. Concentrate on what you can control and practice relaxation and have enough sleep. So at the end, we will see everybody will see, maybe at the end of this session will said, what's my responsibility in this situation? So first, you need to to stay safe and to take care of your health, your mind, your health, your mind, your body, your family and beloved one, and your country for sure. This is the end of the session. I hope all of you guys to stay safe, to stay home, and to take care of yourself and loved one. And always try to think positive. And inshallah, this situation will go, and we will return back to our normal life and with our family and friends. And now we'll back to you, Khalfan, and to check your questions. Khalfan?
Yes. Thanks, Mrs. Isra, for your well informative presentation. I hope that the guys remember to write down their questions, and it will be answered now by Isra. As the time permitted, we will try to answer your questions. All right, and if any question wasn't be answered, then yeah, and we learned a lot from Isra, okay, about how to take care of the patient, and the special message she gave us to that some medication need special caution, such as lithium, depot, long-acting injection, especially handy for patients with psychiatric who has COVID-19 symptoms. She also gave us many tips to stay home safe without anxiety for us and people around us. She gets us special care for elderly and for those who are isolated. Well, guys, note that Pharmaceutical Society receive your opinions and sharing experience. So contact them if you need anything, and don't hesitate to contact through the Twitter and Instagram of Pharmaceutical Society. Of course, Pharmaceutical Society, we are so glad for that. The members of the Pharmaceutical Society, they are well presented pharmacy sector public awareness during COVID-19 with the cooperation of DGMS, DGPA, and different pharmacy sector in Oman. Back to you, Isra, to answer the questions.
Thank you, Khalfan. There are some questions here. We will try to answer all of them, as there are not many of them. So the first question is, how can I support my children during COVID-19? As I know, like as I mentioned, that the situation is a new situation for all. So it's even difficult for the parents, not only for the children. So what you can do as a parent during COVID, to support your children, especially that they are not supposed to be to go out, like to do any other activities. So try to give them to teach them the new skills, like or new games, and give them some gifts in between time to time. Just make them happy, to make them satisfied. Try to talk with them a lot. Try to not scare them. Try to not talk about in front of them about the situation and how the situation is dangerous or people are dying. Try to talk about things that will go on. So there are people that taking care of us, and this is what I can tell you. And if you need any further support, I forgot to tell you regarding a mental issue, your children, your adolescents, your elderly, you can contact Almazroi Hospital from Sunday to Thursday from 8 to 2. There is a hotline you can see from their Twitter, a contact number. You can contact them there. They will give you all the help. Okay, then the other.
I'm afraid the time is done. So the other questions you can answer later on the social media. All right.
So we'll try, yes.
Yeah.
So thank you, Khalfan.
Thanks a
Thank you.
lot. Thanks a lot, Pharmacist Isra, for this great evening today. Please remember, everybody, that webinars will still be continued by the next week and the week after. Just follow up the social media of Pharmaceutical Society and get the news from there. Thank you.